What is the N-nose test for cancer? The N-nose test for cancer is a screening test. So that means it's developed for healthy people to see if they have cancer, or to see maybe if cancer is just beginning. Like sometimes hear phrases like cancer stage 0 or precancerous cells, that kind of thing. It is a test using a worm, or I guess a bunch of worms, nematode worms. And I think the type they use are kind of like typical parasitic worms that may live in you or in your pet or whatever. These little worms, and you give them a sample. I think the N-nose test typically uses a sample of urine, and these worms are chosen and cloned to be very, very sensitive to some molecules associated with various types of cancer. And I believe that the sample's put on a microscope slide, and there's a bunch of these worms wriggling around, and if they all move away from the sample, then it's unlikely the sample comes from a cancer patient. And I think this has all been developed in Japan, this test. So I have had the test, I should say that, which you might find interesting because, of course, I'm a cancer patient. But it was a time when I was NED, no evidence of disease. So potentially not really useful just having it once, but maybe having it, I guess, every few months, maybe, as a cancer patient. If you're in that state of no evidence of disease, where scans are not showing any cancer, your blood tests all look normal, and you want to know, is it safe to stop chemo? Am I in the clear? That kind of test may be useful. As a screening test, the idea is to test loads of people, potentially test everybody, or maybe test everybody as just part of a health check, maybe test at-risk people, so people who are likely to have cancer, maybe because they work with some industrial chemicals that are carcinogenic, or their aircraft cabin crew who are at high risk of cancer because of flying around. And the idea is with these kind of screening tests is not that you do the test and the doctor says, I'm afraid to tell you, the test shows you got cancer, let's cut you up. It's more of like, this test shows you potentially have cancer, let's do some more testing. And it'd be a series of blood tests, some, a scan, typically. So the N-nose test is potentially exciting because it seems to be very sensitive, so very good at finding people with cancer. It's been tested on, well, there's like big tests, the test was tested on samples from cancer patients and healthy people. But then also the test was trialed on real people as well. I think in an area of Japan called Fukuoka. I believe it was like local government employees, and it proved to be useful. Like found a bunch of people who potentially had cancer who were unaware of it, and those people had testing, and some of them, when screening works well, it can find people with early stage cancer who are completely unaware of it. They can have a small amount of curative treatment and get a absolutely fantastic outcome in cases where screening works well. Unfortunately, screening generally doesn't work. I do have to say that it's not because of the screening itself, but just because of the medical system and just because of issues in really diagnosing cancer. It's very, very difficult to diagnose early stage cancer, and if you screen aggressively and then you kind of pursue the cases aggressively, there's a big risk of doing unnecessary medical treatment, particularly surgery, which is very distressing if someone has bits of their body removed that they were very attached to physically and emotionally, and maybe later it turns out it was unnecessary. So I know cancer patients are always gone about, we need more screening, but currently, at least in every health system that I've ever looked at, it's not particularly effective. Maybe that will change with the N-nose test when it becomes widespread. It's only a few years old, this test, a couple of years old. One reason I think it's potentially very exciting is it could be used to speed up cancer research. It may just be really useful if it can be safely incorporated in like as a mechanism in clinical trials. It could be kind of amazing because it's so much more sensitive than like a normal blood test. So you might be able to test out a treatment and see very quickly if it's making a difference, and that could change the way clinical trials are done. You could maybe have more of these like crossover trials where the control group gets the treatment as well later on, that kind of thing. So N-nose test, kind of exciting. The reason I should kind of explain a tiny bit of the technical stuff. You've probably seen reports in the media of like the dog that can smell cancer on a patient's breath and this kind of thing. How smell works is fascinating and very difficult to understand. It's to do with something called chirality, which is like the layout of molecules, where you can have a molecule that exists in a left and right-handed form, and you can't like lay the left-handed molecule in a certain way that it is the right-handed one, and smell is connected with this. And it turns out that some dogs, so a very, very, very low percentage of certain, I guess, species of dogs are able to smell cancer and can be trained to detect it. This is incredibly expensive to do. It takes ages. At the moment, you can't kind of easily and cheaply just clone a dog. You can, however, easily and cheaply clone nematode worms. So that's why worms are used for this test. That happens to be a minute percentage of presumably a certain type of worm can sniff out. Remember, it's not like, I think it's not that they're sniffing out the cancer cells. It's more of like molecules associated, bioactive molecules associated with the cancer cells. And these worms can kind of sniff it out and wriggle across to the other side of the microscope slide or whatever. And if you do it with a bunch of worms, you could like see 85% of them have tried to get away from the cancer sample of the person sample, I guess. They're not a patient yet, because hopefully they don't have cancer, but the sample from the person being tested, maybe 80% of the worms have wriggled away, so that's a case where you'd want to go and do some more testing, and yeah, maybe keep an eye on the person, right? So hopefully that has been useful, the N-nose test. And please post your questions and please hit subscribe. It helps so much. Thanks a lot.